In your article, Dr. Roberts, I noticed that there was a concern that you had about and observed a psychotic teenage girl who had been dabbing highly concentrated, potent THC. Can you describe a little bit about what that experience was like, not only for you, but also for your patient?
Well, and I'm even going to go beyond that. It's not just the patient, it's everybody else in the ER.
Wow.
So if you can picture this is somebody coming in and most people don't have the clear definition of what it means to be psychotic. That means screaming uncontrollably, taking multiple security guards to hold you down and strap you to the bed, sometimes coming in with a spit mask on. And you have, the nice little old lady next door who might be having a heart attack or a stroke or whatever else she's having is now coming to her door to look and see what's going on because there's somebody just screaming absolutely uncontrollably. And I wish I could tell you that was an isolated experience.
Wow.
That happens, to say daily may be a stretch, but every other day that somebody's being brought in a spit mask and needing to be held down because they're completely psychotic is probably almost daily.
Wow. And is that, are those patients specifically then, do they self-report that they've been using marijuana?
So by policy, everybody who gets a psychiatric evaluation has to have a drug screen because they want to know what influences are causing that behavior, because we need to assess them. Are you having underlying schizophrenia? Are you having some other underlying thing that might be causing that we need to get you to a psychiatric treatment for? And again, without having specific numbers, close to 100% of those are testing positive for cannabis. Now with that, they're also having high alcohol levels, having methamphetamine, cocaine, LSD, you name it. I've seen it down there, and certainly all those things are contributing to the amount of psychosis, but there's quite a number of them who are just on, that's all it tests positive for is cannabis out of all of that.
Wow.
And it ranges the gamut. I mean, I talked about that young girl who was brought in psychotic, but just recently there was a man who was completely naked, who was on top of a train in the middle of the city, who they called the paramedics and brought him in. Another kid was out wandering somewhere outside of Lamar and sunburned really bad, didn't really know where he was, and so the police brought him in. Treatment almost doesn't exist. So what I mean by that is these kids will come in, they're completely psychotic, so they finally sober up and we want to get them into treatment. And treatment might be from a psychiatric standpoint, so somebody who's suicidal, maybe even homicidal, or maybe even they just have some underlying schizophrenia that needs to be treated and was made worse by the other substances involved. There's no funding for that, so there's no programs for them to go to. What happens is they sit in the ER, and sometimes they sit there for a day, sometimes even 2 days, and they're sitting in our ER room waiting for some place to have a bed available for them to go to. Sometimes one finally opens up and they get to go, but sometimes finally they decide that they want to leave. They've been in the ER for over a day in that same one room, and I don't blame them for feeling like this. I'm worse off here than I was just out in the community. Just let me go. That's the statements I said earlier about being suicidal or that I didn't really mean it, and let me go home. So they go home because there's nowhere else for them to go.
Yeah.
I think there's a movement to recognize that we need more treatment for things like opiate abuse, and although that's been really slow, luckily we're seeing things like some of the needle exchange centers are there, and we're starting to get things like Suboxone and even methadone and some things that may be more controversial, but we're trying to get treatment, and we're trying to decrease the use of opiates. We understand now that we need to get these people treated and that effective treatments exist. Something like cannabis, on the other hand, I mean, there's no treatment, there's no program. The programs are already full with the real drugs.